What's the difference between MALT and DLBCL stomach lymphoma? When discussing stomach lymphoma, a common question arises. What is the difference between Mucosa-Associated Lymphoid Tissue lymphoma and Diffuse Large B-Cell lymphoma? Both are types of lymphoma that can affect the stomach, but they have distinct characteristics that set them apart. MALT lymphoma is a low-grade, slow-growing type of non-Hodgkin lymphoma. It originates from lymphoid tissue associated with the mucosal lining of the stomach. This type of lymphoma often remains localized for years and is closely linked to chronic inflammation caused by Helicobacter pylori infection. In many cases, early-stage MALT lymphoma can be effectively treated with antibiotics aimed at eradicating H. pylori. This treatment can lead to regression of the lymphoma in many patients. On the other hand, diffuse large B-cell lymphoma is classified as a high-grade aggressive lymphoma. It is characterized by large, rapidly dividing B cells. DLBCL can either develop on its own in the stomach or evolve from a pre-existing MALT lymphoma. Unlike MALT lymphoma, DLBCL tends to present with mass-forming lesions and significant thickening of the gastric wall. It is also more likely to spread to abdominal lymph nodes. Due to its aggressive nature, DLBCL requires more intensive treatment, typically involving chemotherapy and immunotherapy, rather than just antibiotics. The differences between these two types of lymphoma can be summarized in several key areas. First, in terms of cell type and grade, MALT lymphoma is low-grade and consists of small lymphocytes, while DLBCL is high-grade and made up of large B cells. Second, MALT lymphoma grows slowly and often remains localized, whereas DLBCL grows rapidly and is more prone to spreading. Another important distinction is their association with H. pylori. MALT lymphoma has a strong link to this infection and often responds positively to its eradication. In contrast, DLBCL may or may not be associated with H. pylori and typically requires systemic therapy. When it comes to imaging features, MALT lymphoma shows superficial mucosal changes and mild thickening of the stomach wall, while DLBCL presents with mass lesions and marked wall thickening. In terms of treatment, MALT lymphoma can sometimes be managed with antibiotics in its early stages, while DLBCL generally necessitates chemotherapy and immunotherapy. Lastly, the prognosis for MALT lymphoma is generally better compared to DLBCL, which tends to have a more aggressive course. Understanding these differences is crucial for accurate diagnosis and treatment planning. Genetic factors such as the T1118, Q21, Q21 translocation are more common in MALT lymphoma and can influence treatment outcomes. However, the presence of this genetic change does not rule out the possibility of transformation to DLBCL. If you have concerns about stomach lymphoma or any related symptoms, it is essential to consult with a healthcare professional for personalized advice and treatment options.